Hi, I'm Cheyenne, and I'm going to be presenting the persuasive speech topic to my family.
Don't forget about Bob.
Sorry about that. The need for clean needles in the IV drug world is critical in the prevention and spread of AIDS and hepatitis C, along with other bloodborne pathogens. Of the 16 million drug users, 3 million of them are living with the HIV infection. The spread of diseases like HIV can and need to be prevented, and needs to be prevented to the best of our ability. I picked this topic since I am going into nursing. I have a chance to be stuck by a dirty or infected needle, so this topic really does matter to me. HIV and hepatitis C have been on the rise with IV drug users and could be prevented with these kind of programs. Needle exchange programs lowers the risk for spreading diseases, and it doesn't really promote IV drug use, only promotes risk-reducing behaviors amongst the IV drug user using community. Let's begin with how bad HIV and hepatitis C really are. According to the CDC, 2.7 to 3.9 million people are infected with chronic hepatitis C, and 1.2 million people were diagnosed with HIV, while 156,300 people were not diagnosed with the disease but currently living with it. Needle exchange programs could help prevent the spread of HIV and hepatitis C. With 34 states doing some sort of needle exchange program, we can reduce new infections of both diseases. In Austin, Indiana, there were 163 new cases of HIV in a town of 4,300 people. They now have a needle exchange program during this quote-unquote state of emergency. This is currently in all of Scott County. Unfortunately, only 170 people have signed up for the needle exchange program in Scott County. Kentucky has also seen a rise in hepatitis C, and they would like to prevent further spread of this disease. Not only do these programs help the users, they help prevent the spread of diseases to the healthcare workers by decreasing the chance for a nurse or a doctor or a paramedic or EMT or even a cop to get stuck by a dirty needle. Kentucky also plans to teach prevention strategies at the needle exchange places, and they also are promoting vein care, which is very important just for life itself. Rhode Island uses the needle exchange program as well, but they also offer education, counseling, outreach, and they refer people to different rehabs. We have talked about what some states are doing to help prevent the spread of disease. Now let's consider what can happen if they continue to spread. Since these diseases are currently on the rise, again, 1.2 million people were diagnosed with HIV, while 156,000 people were not even diagnosed yet, but they have it, so they don't know that they're spreading it. In Washington, D.C., 2.4% of the residents have HIV or full-blown AIDS. Of those, 14% are known IV drug users. So they're also spreading the diseases because they're using IV drugs. Between 2000 and 2001, the number of teens and adults with HIV increased from 40,766 to 41,311. There are 2.7 to 3.9 million people that are currently infected with chronic hepatitis C, and 30,500 acute cases in the United States. 75 to 85% of acute cases will turn into chronic cases of hepatitis C. About 12,000 people a year die from liver complications directly related to hepatitis C. According to the CDC, 50 to 90% of people infected with HIV also have hepatitis C. We talked about HIV and how bad it is, how you can have both HIV and Hep C along with how bad Hep C is. Now let's consider that maybe these programs aren't really all that bad, and they certainly don't cause more IV drug use. Needle exchange programs do not promote drug use and do good things for the community. These programs give the homeless and unsteady homes alternatives. Many of these programs not only have needle exchange programs, but drop-in places where people can get mental health help along with a warm place to sleep. These also help hard-to-reach people, and it doesn't force anybody to change like traditional health does, like rehab. Do the needle exchange programs actually encourage drug use? No. These places help reduce the drug use by offering things like group therapy, link people to housing and healthcare, and so much more. Elizabeth Owens was a former IV drug user that said when she went to one, she found something that she never seen before. She found people that cared, and now she's been drug-free for over 2 years. Kentucky does have a strict 1-for-1 exchange program, so if you bring 1 needle in, you get 1 clean needle back. If you bring 2 in, you get 2 back, so on and so forth. We have talked about how these don't harm anyone. Now let's consider that they do help and are a good thing for every community to have access to. Needle exchange programs are a good thing in every way, shape, and form. HIV and Hep C are on the rise and very deadly. These programs can help reduce the amount of new cases of these diseases we see and possibly help reduce drug use altogether. They also do great things for the community and do not help promote drug use. Thank you. Yes. Have a good night. Bye.